Hello students, I will show you today an important instrument which is very commonly used, especially in the major surgeries, in the abdomen, other areas, pelvis and so. Just identify it. So what this instrument is, see, look at that. Look at this curved, stout instrument with a smooth handle like this, very stout. You can look at this instrument, very stout. So what is this instrument? It is a Deaver's lever retractor, D-E-A-V-E-R lever retractor. What are the uses? So features already, see that, look at the features here. It is curved, stout, atraumatic, heavy blade, smooth it is. It is used to retract livers, soft tissues, organs in the abdomen, thorax, retroperitoneum. So in a major surgery, it is, even though it is called the Deaver's lever retractor, any organs, soft tissues, wide area it covers, colon it can, small bowel it can cover. You have to put a mop underneath so that nothing will spill over that. And it, if at all, even though it is atraumatic, may cause some crush injury to the organ like liver and bowel and mesentery. And so to avoid that, you put a mop and then use this one to retract. So it retracts very well. It's retracted with the levering action, not pulling or pushing, like this levering. So that bend is important. It's atraumatic, remember, but it's a manual, not self-retaining. So what are the features? It is stout instrument with a smooth, wide curved blade. It uses the levering action, not by pull or push. It's a atraumatic manual. This much you have to remember. A very useful instrument in the abdomen, major surgeries, wide areas, any wide areas, in renal surgeries, radical nephrectomies, pelvic surgeries, bowel surgeries, very essential instrument. Any surgery in the depth to retract, it is very useful. And blades, maybe blades are sometimes little narrow, smaller sizes will come, small size, medium, very large size, very stout, wide Deaver retractors are available. So depending on the situation, you can use a different sized Deaver retractor. Very, very useful, especially abdominal surgery and also in other surgeries also. So very commonly kept instrument in the exam, oxy they will keep for the UG, postgraduate will be kept in the Viva, and you have to detail about it, its uses, how it is being held, and how what is the methodology, how it acts also, you should know. So that is the Deaver's retractor. That's how exactly, see that? See that? That's how exactly retracted. It's a stomach here, gastrectomy, beginning of the gastrectomy here. Liver is retracted very widely, see. One more in the pelvic surgery, see that? This is retracted very nicely. It's a manual, assistant hand is here. So it's a manual retractor, of course. So go through my surgical, clinical, SRB clinical methods in surgery, current edition, or how to examine a patient with the video lectures, and also go to my manual current edition in detail about all topics with the quotations, with the MCQs online and case scenarios, detailed description of everything. So manually, so covers everything. Please go through it and read it. And my surgical operations, details about 2-volume book, details about everything, about different surgical procedures, gastrectomy, anything, any GI, basic surgery, suturing, everything. So please go through that also. Skill of the suturing in a small atlas, 100 pages around, and use a very detailed how to use the instrument, how to do a suturing technique, tissue approximation with the proper appropriate videos to understand the thing. So please go through these things, and also my DigiNow lectures covering all CBME, everything surgery, general surgery to specialties, basic urology, neurosurgery, operative surgery, X-ray instruments, and every topics with the clinical examination videos. Everything is there as a DigiNow, widely covered. So you can subscribe for a year, and during your exam, both UGs and postgraduates will be very, very helpful. So students, I hope you have understood this Deaver instrument very well. Thank you very much.